about many of the challenges that she's facing working in her hospital in Ghana. I'd like to know if you have had similar challenges or if there are different types of challenges that you experience. And maybe you could also start by saying what your area of work is as a health worker.
Okay, so thank you so much. My name is Boma Otobo, and recently retired from the National Primary Healthcare Development Agency in Nigeria, although I'm still involved in immunization, and I'm so glad to be here today. Yeah, listening to Ruth, I think I didn't feel too out of place with her own examples. And yes, I've had similar.
Oh, Boma, we can't hear you. Are you still there? Boma, you're on mute. Can you unmute yourself?
Okay, yes.
Great.
So sorry, I think there's also some welcome going around the corner. Yes, I've had similar issues, just like Ruth has explained from the video we all saw. For me, those gender-related issues are very right. They are there, and we're trying our best as workers to see how we can actually minimize these inequalities. I'll give one, for example, training. You find that when there's a program coming up, you will find more of the participants are males rather than females who are actually the caregivers who can relate better with the mothers. So when you find that during training, more of the males are selected, I don't know how that comes up, but where you give a pre-test, you give the criteria, you find the males are able to even do better. And one of the issues too could be because of the preponderance of early girl marriage, you find that some of these girls do not have the opportunity to go back and complete their education. So more or less, they are discriminated against based on the level of their educational qualifications. So I think what Ruth has shared is actually very right in our communities. And we're trying our best, like I said, to minimize all of this, but we haven't gotten so much. Secondly, when you also think about who brings the child for a vaccination, it is the mother. She is the caregiver at home. Unfortunately, she does not control the household finance. So there again, she's more or less disadvantaged because she cannot but have to depend on the husband who gives her the transport to bring the children to vaccination. So these are some of the things we do find in our communities. And like I did say, we're trying our best to see how we can mitigate all of this because they definitely affect the immunization coverages that we see around. Over, thank you.
Thank you, Boma. So you shared some of the additional challenges. When you were nursing, what were some of the approaches that you as a nurse or within your own clinic used to ensure that mothers were able to bring their children in? What were some tips that you would suggest that are good interventions that can be used?
Okay, so I'm not a nurse. I'm also working at the national level, but I do interact with those at the lower levels, especially when I go for supportive supervision. So one of the things that has been done, and this is working, is raising the level of community awareness. We have gatekeepers in the community, and so we first of all go to the district head's house to inform that immunization will be taking place. Let's take an outreach as an example. When we go prior to that period, we inform them and tell them of the timing. And we also find that that has worked because they listen to these gatekeepers and whatever he tells them to do, they do. But I will also say one thing has been also against the system in the sense that poverty has been a major issue. These same mothers have to go to the farms to help even the heads of house to take care of the plants and all of that. So they have to fend for their communities. So having to tell them to stay back sometimes it's not good enough. So you go and you will not find them there. So we use the gatekeepers to create a lot of awareness and encourage the mothers to ensure that the children are brought to the health facilities for vaccination.
Thanks, Boma. Ruth, I'm just wondering if you would like, oh, sorry, Nicholas, I should have said this before, but I'm wondering if Ruth would like to come online, and maybe this question is both for Ruth and Boma, because you both mentioned how leadership in the health field is very much dominated by men. And we saw in Shobo's presentation as well, we know that it's roughly 70% of the health workforce is female. We saw some participants in the chat saying that 90% in their countries are female. But in leadership, if we look in leadership decision-making positions, in middle-income countries, it's only about 5% across the way. There's a really good question by Karen Page, who's asking about other people's experience with men taking over decisions. So I'd be really interested to hear from you, Boma, and from Ruth, if that is also the case in your countries, and any interventions that you can think of to try to address that imbalance in leadership positions, and how we can get more women in decision-making positions.
Okay, you want me to speak?
Yes, please.
Go ahead. Okay, good. Yes, you're very right that in leadership we have more of the males than the females. Like I did say, this comes from cultural backgrounds, cultural issues, cultural related issues, where more of the males are the ones who get educated to those high levels, and so they have the opportunity to occupy such positions when they are available. Now, talking about how we've been able to mitigate and get more women on board, yes, we encourage more women to come on board. In some instances, we try to reserve the position. For instance, if we go to a community and the barrier, the cultural barrier exists, where it has to be the woman who can go in to, for instance, when we talk about tracking defaulters, it's only the females who are allowed access into the homes. And then you have no choice but to reserve some of these positions for the women. It's no use asking the males to occupy the positions when we know they will not be useful. So there's a UNICEF example which is very ripe, and that's the role of the VCMs. I want to believe that over 99, in fact, if not 100% of the VCMs I've met on the field are all females. So that actually is really helping. And I want to still encourage that goes on for as long as it's feasible. Yeah.
Thanks, Boma. And Ruth, I see you're online now. Do you have any suggestions for how to address the poor representation of women in decision-making? Ruth, you're on mute. Can you unmute yourself?
Okay, I'm so sorry. Yeah.
Thank you, Ruth.
Thank you very much for the opportunity. My name is Ruth Allotey. I work in Kolebu Teaching Hospital. It's in Accra, Ghana. I'm a nurse and a health promoter. Now, I really appreciate the factors that Boma raised, and you can see that we are all coming from the same region, even though we are not in the same country. So I will borrow her words by saying some of them, you actually don't have a choice than to leave some of the opportunities for the women. So when you come to the hospital facilities, you have all the nursing heads being females. Almost all the nursing heads are females, but the overall heads of departments are usually males. So if it's a medical department, the HOD is a male, and then the nursing head is a female. So I think doing that across can also help. But when you come to the general administration, most of the heads are males, which is actually not working well for us. Will it be better if women who have similar opportunities be also given the opportunity to try? Because it hasn't started like that, but we can start from somewhere. Let us see what a female chief executive can do.
Oh, Ruth, you've
for the
paused
country.
there.
Sorry. Please, is it okay? Am I audible?
We just missed the last bit.
Okay, sorry. So I was saying we should give opportunities for females to also try to become chief executives, to become heads of institutions. Let them try. Let us see what they can bring. Will the result be better than the males? So then we'll have a point, a baseline to say, yes, let's focus on this gender equality fight. Let's not just reserve this position for males only. Let's put some females in high positions. And then together, I believe we can make a headway.